Hi, before we get started I wanted to go through two things. First of all, how to use the course, and secondly, why I think this course is really important. First one, how to use the course. This course is not supposed to be watched from start to finish in one session. Each week, watch one video, do one lesson, take the time to practice. Use the audio files and the writing practice sheets during that week. Now the other part of practice is to make sure that you spend time while you're working on your clients talking to them about the muscles that you're working on. This will build your confidence, but it will do something else, and this is why I think the course is so important. It'll build the confidence of your clients in you. When you're talking to them about the muscles, you're educating them, you're giving them information. And in turn, they'll learn to trust you more. And by trusting you more, they will become repeat business. They'll keep coming back to you because you give good massage and you also talk to them about the muscles and what's going on in their body. But the other thing is that they, because they trust you, will start to refer their friends to you as well. And so I really hope you enjoy the course. I hope you get a lot out of it. Take your time with the course. One video per week. Download the audio files. Practice listening to the audio as well as saying the names of the muscles, the origin, the insertion, and the action. And practice your writing. I hope you enjoy the course. I'll see you in the next lesson. Hi. Over the next 3 weeks, we're going to be working through the major muscles of the back. Remember to take it 1 week at a time. One lesson for 1 week. Watch the video as often as you want during that week. Download the audio file, listen to it and practice saying the names of the muscles. But the most important practice that you can do is actually practicing while you're working on your clients, talking to them about the muscles, because this will build that rapport, that relationship, and they will understand that you're a professional who has a great deal of knowledge and cares about them. See you in the next lesson.
Major back muscles, Part 1. Trapezius. The origin of the trapezius is the occipital bone and C1 to T12 spinous processes. The insertion of the trapezius muscle is the lateral third of the clavicle, acromion process, and spine of the scapula. The upper fibers of the trapezius have the action to extend and laterally flex the neck, elevate and abduct the scapula. The middle fibers have the action to retract the scapula, and the lower fibers have the action to depress the scapula. The trapezius. The levator scapulae. The origin of the levator scapulae is C1 to C4 transverse processes. The insertion of the levator scapulae is the superior medial border of the scapula. The action of the levator scapulae is to elevate the scapula, lateral flex the neck, adduct the scapula. Levator scapulae. Supraspinatus. The origin of the supraspinatus is the supraspinous fossa of the scapula. The insertion of the supraspinatus is the greater tubercle of the humerus. The action of the supraspinatus is to initiate abduction of the humerus. Supraspinatus. Infraspinatus. The origin of the infraspinatus is the infraspinous fossa of the scapula. The insertion of the infraspinatus is the greater tubercle of the humerus. The action of the infraspinatus is to lateral rotate the humerus. Infraspinatus.
Hi, I wanted to take a moment to let you know Udemy will be contacting you very shortly to rate this course. Now, I want to produce a 5-star course. Every course that I develop, I want it to be a 5-star course. Now, if you think that I can make improvements, drop me a line. Let me know specifically what needs to be improved so that I've got a chance to develop it into a 5-star course. I hope you're really enjoying it. I hope it's adding value to you, your clients, and your business. And I look forward to seeing you in the next lesson. Bye for now.
Major back muscles, Part 2.
The rhomboids. The rhomboid minor and major muscles. The origin of the rhomboid minor is C7 to T1 spinous processes. The origin of the rhomboid major is T2 to T5 spinous processes. The insertion of both rhomboid muscles is the medial border of the scapula. The action of the rhomboid muscles is to retract and adduct the scapula. The rhomboid minor and major muscles. The teres major. The origin of the teres major is the inferior third of the lateral scapula. The insertion of the teres major is the intertubercular groove of the humerus. The action of the teres major is to medially rotate, adduct, and extend the humerus. The teres major. The teres minor. The origin of the teres minor is the superior 2/3 of the lateral scapula. The insertion of the teres minor is the greater tubercle of the humerus. The action of the teres minor is to lateral rotate and adduct the humerus. Teres minor.
Major back muscles, Part 3.
Latissimus dorsi. The origin of the latissimus dorsi is T7 to S5 spinous processes, the iliac crest, and inferior angle of the scapula. The insertion of the latissimus dorsi is the intertubercular groove of the humerus. The action of the latissimus dorsi is to extend, medially rotate, and adduct the humerus. Latissimus dorsi. Serratus anterior. The origin of the serratus anterior is lateral rib 1 through 9. The insertion of the serratus anterior is the anterior medial border of the scapula. The action of the serratus anterior is to protract and abduct the scapula, holding the scapula towards the rib cage. Serratus anterior. The Erector spinae, made up of 3 muscles: the spinalis, longissimus, iliocostalis. The origin of the Erector spinae are the posterior sacrum, C4 to T12 transverse processes, C4 to L5 spinous processes, and ribs 1 through 12. The insertion of the Erector spinae is the mastoid process, C2 to T8 spinous processes, and C4 to T12 transverse processes. The action of the Erector spinae is to extend, rotate, and laterally flex the spine. Erector spinae. Multifidus. The origin of the multifidus muscles are the posterior sacrum, L5 to C2 transverse processes. The insertion of the multifidus is L5 to C2 spinous processes. The action of the multifidus muscles are to rotate, lateral flex, and extend the spine. Multifidus. Rotatores. The origin of the rotatories are L5 to C2 transverse processes. The insertion of the rotatories are L5 to C2 spinous processes of the adjoining vertebra above. The action of the rotatories are to rotate and assist in extension of the spine. Rotatories. Quadratus lumborum. The origin of the Quadratus lumborum is the iliac crest. The insertion of the Quadratus lumborum is L1 to L4 transverse processes and the 12th rib. The action of the Quadratus lumborum is to extend and laterally flex the lumbar spine and help to stabilize the diaphragm in deep breathing. Quadratus lumborum.